and it's preparing itself.
I have a message in my top right corner that said meeting is now live, now streaming live.
Okay, we're good to
All
go.
right, so we're good. All right. Well, good morning, everybody. I want to welcome you into our Health and Wellness Advisory Committee meeting for Wednesday, September 4th, 2024. It's been a little while since we met, so it's nice to see everybody on here. Appreciate your time and efforts. I know it's a busy time. Everybody, I hope, had a great Labor Day weekend, and it seems like that's the end of our playtime, and it's time to get back to work. A lot of time. I know all the kids are back in school for Maggie, and they're busy over there. Football season's back, although maybe not as exciting as we thought it was going to be for a start. But football season's back, and the temperatures are a little cooler this morning. So a great day overall, and I just want to tell you how much I appreciate each of you giving your time to this committee. First on our agenda is our committee minutes from June 5th. And when the meeting minutes went out, it had the wrong date. So I'm going to ask that that someone make a motion to approve that as amended for June 5th. Can I get a motion to approve the minutes, please?
So moved.
Okay, we've got a motion to approve the minutes. Can I get a second?
Second.
All right. Any discussions, deletions, additions? And obviously we did say for June 5th, 2024. All in favor of approving the minutes, please say aye. Aye.
Aye.
Any opposed? The minutes have been approved. All right. So we have on our agenda this morning the SCEIRC final report recommendations on health disparities. And we have HART commissioners. I think we have Dr. Bonnie Cleveland and Jerome Harris. Is that right? Jerry, are you out there? I saw you a minute ago.
He was here.
Yeah. Let's see if that's him coming back on. I'm not sure what happened there. Okay. Well, I'll tell you what we can do. I guess until we see Jerry, maybe we can go right on to agenda item number 4, and come back when he's back on here. So so we have our community health and wellness updates. I'd like to call on Dr. Katie Richardson, if you would, please. Dr. Richardson, I can't. Oh, there you are. I couldn't hear you for a moment. Okay.
You can hear me now?
Yeah, I can hear you now.
Okay, wonderful. Good morning, everyone. Several things for today. The first is that we've talked about the Tri-County Data Walk that happened in North Charleston a couple of months ago, and I just wanted to give you an example of how one city is using partnerships to address some of the issues raised with the data. So on September 21st, the town of Moncks Corner and MUSC Children's Health are hosting a Berkeley County Safety Fair that will be at the Moncks Corner Rec Center, and it's open to the public. And basically this grew out of the data walk. Partners decided to host an event to provide education about water safety, fire safety, gun safety, safe sleep, and other safety issues after seeing those rates come in higher than some other places in the state and much higher than they wanted to see them for preventable injuries. So that's something that perhaps this committee would think about deciding that we want to sponsor here in the city of Charleston based on some of that data. And as we had a speaker, I think at our last meeting, talk about some of that data. If there's an area of interest, including injuries, we could certainly have someone from Department of Public Health come and talk about that data and then use that as a catalyst to hold an event. So just wanted to start with that. It is the beginning of respiratory virus season, and so I did want to mention that the new COVID vaccines are available. Those are from Moderna and Pfizer, and Novavax will also be available very soon. For those who have had COVID, we've had very high levels of COVID, and we continue to see that across South Carolina, and that's really measured by wastewater surveillance now with less people testing at the doctor's office. But if anyone has had COVID in the past 3 months, I do recommend that you wait and get your next vaccine after 3 months have gone by. Otherwise, anytime is available. And the recommendation is everyone 6 months and older to get a booster of that COVID vaccine this fall. Flu vaccine is also beginning to be available. We are not seeing much flu yet, but when we look at our neighbor, the state of Georgia, they are beginning to see flu cases. Often flu does start in the South. So anytime between now and the end of October would be a good time to get your flu vaccine. It does look like it's a good match this year, looking at the Southern Hemisphere and the flu that they've had there. And so certainly I recommend that flu vaccine. And finally, the recommendation for the RSV vaccine has changed for older adults. Now, everyone age 75 and over is recommended to get 1 dose of the RSV vaccine, and those age 60 to 74 who may be at increased risk for severe RSV. And that's really the same populations at risk for severe flu and COVID are recommended to get a single dose of RSV, as well as those 75 and over. And that can be anytime as well. I just wanted to briefly review the guidance for those testing positive for COVID. The guidance, according to the CDC, really now groups all respiratory viruses similarly for guidance. The core prevention strategies are immunizations, and those we just discussed. COVID vaccine studies show decreases severe disease by half, and that is similar for the flu vaccine. Over 95% of those hospitalized last fall were not up to date on their COVID vaccine. And so again, preventable with being up to date, and that is available now. Hygiene, mostly hand hygiene, is important for decreasing risk of all of those viral illnesses. Increasing or improving air circulation and clean air in indoor spaces, also very important. Just a reminder, the treatment is available for COVID. Paxlovid is still recommended for those at risk for severe disease, and the sooner it's started, the better. And finally, staying home to prevent spread. And this is where the guidance has changed from what was initially 10 days and then 5 days. Now the guidance is stay home and away from others until you're fever-free without fever-reducing medications for 24 hours and your symptoms are getting better. So there is not that automatic certain number of days. It's feeling better and fever-free for 24 hours. And then the recommendation is to take added precautions for the next 5 days. That could be masking, distancing, and so that's the sort of not new, but new for this fall guidance around COVID. And I'm happy to chat with anyone who has any specific questions. Feel free to reach out to me. I did want to also mention that COVID test will again be available through the federal government. I heard it's this month, but I've not seen the actual sort of call or link to request those. But please be on the lookout. That should be coming out very soon. And then lastly, to change subjects, Paul sent out some information on a new initiative called I Am a Work of Art that the Department of Public Health is sponsoring. It's really a campaign through the Ending the Epidemics to end the HIV epidemic in the U.S. And it's to encourage people living with HIV who are not in care to seek care, stay in care, and achieve viral suppression by taking their antiretroviral medications. So there is, it's basically using art then to showcase and educate around those issues. And so there is submissions for spoken words, singing, visual arts, and dancing. It can be a group or a solo performance. And we hope to highlight those at the South Carolina HIV, STD, and Viral Hepatitis Conference in late October. The deadline would be October 7th for submissions for that, or through our World AIDS Day observances at the beginning of December. And the deadline for submission to be featured in those observances would be November 11th. So Paul has already sent that out. I think I'll stop there for the moment. We haven't met in a while, and it is a busy time, so I certainly have more I could talk about if people have interest and ask questions. But those are a few of the updates I wanted to bring forth today. Thanks.
Thank you, Dr. Richardson. Any questions for Dr. Richardson? Paul?
2 questions. West Nile virus, any concerns locally, as well as food viruses that we've been reading about with the contamination?
Yes, both great topics that I could have included as well. So West Nile virus, that is a mosquito-borne virus. We have had 2 recent cases here in Charleston County. It is asymptomatic or no symptoms in most people, but can be dangerous, even deadly for some. And so really the prevention message there is just try to avoid mosquito bites. Certainly with the rain we've gotten, we've seen a lot of mosquitoes out. So that's either using bug repellent or wearing clothing when out and about with that. We're also happy to test any dead birds, not any dead birds, some dead birds that you may find in your yard or around, because birds do carry West Nile virus. So if you have any questions about that, please give me a call or call the Department of Public Health. It's mostly songbirds are those that we test for West Nile virus. And then we do coordinate with municipalities and counties around treating the area around where someone's been diagnosed with West Nile virus, as well as catching mosquitoes and testing them to try to decrease risk in those specific areas. We are also seeing foodborne illness. I suspect that you're talking about the boar's head deli meat. That was liverwurst, but likely several other of the deli meats also. Those should be off the shelf, and the deli meats available now should be safe. But because deli meats have a long expiration date, we want to make sure that anyone who has deli meat still at home that they may have bought prior to the recall are checking, either just get rid of them if you're not sure, or check on the Boar's Head website to make sure that the ones that you have are not those that are recalled. They are causing listeria, and that can certainly be severe and cause problems. We're also seeing more other foodborne illnesses like salmonella. And so it's just a good reminder to make sure that that your food is kept cold. Listeria, however, is not killed by cold, and so that's why the deli meats are a particular concern. So those two topics, happy to chat more about that if anyone has questions.
Paul, do you have something?
One more question. I'm sorry. Did you say the COVID test is DHEC? I know you said something about the federal government. Does DHEC still have them on site for people?
Yes, you're giving me all the right lead-ins to things that I should have reminded you. So we do still have free COVID tests as well at all health departments. You just have to come in and ask. We are running somewhat low, so I think you can only get 2 tests now each day that you come in, or each person that comes in. But those are available at our health departments, and we'll continue to offer them as long as our supplies last.
And then one last more of a statement. Katie had helped me initially when we did the listing of everybody that was at the Teddy Pryor building there on Rivers and McMillan. And we are in the process with DHEC having a new name of Director of Department of Public Health. We're just going through that list right now, making sure that sheet is updated, and then we will send that out. Hopefully in the next month or two, we will have that out to everybody with all the updated information and any new phone numbers that exist over there. So, and that, Jerome, for you and any others, that is just a listing of all the different state and county agencies that are listed there at the Teddy Pryor Center. We wanted to make sure that all of our neighborhoods knew where those state agencies or county agencies had all relocated to and what services they had available to them. So since Charleston Center moved over there with and now there's a whole host of them over there. I don't want to leave one off, so I'll just say there's a whole host of them over there. And we want to just ask you, whenever you do get that updated one, anything we can do to just get that information out. And it's on a bus line, and we send it out to our neighborhoods and other groups, but it's one we got to just keep pushing to let them know where that is. And they have free stuff such as the COVID test or Narcan kits and other items. So it's a great way to just stay in touch with what's available to you.
Thank you, Paul. I'll just finish with one more thing. On September 26th, it's called Save a Life Day, and it is really being used as a time to remind the community of the importance of naloxone and how it does save lives for those who are having an opioid overdose. And so, yes, we do still have naloxone kits at all of our health departments, as well as Charleston Center and others around the community. So please help us use that day as a reminder to our community to have naloxone on hand if you may be around and willing to use it for those who would be overdosing. Thank you.
Thank you, Dr. Richardson. Any other questions, comments on there? And Dr. Richardson, I know that we need to get back with the mayor's office in Deja on some things for the SHAPE initiative, and I'll work on that today. So
thank you.
All right, very good. All right, so we're going to go back to agenda item number 3 because I see Mr. Jerome Harris is on now, and he's got the SCEIRC final report recommendations on health disparities, and he serves on our Heart Commission. So, Mr. Harris.
Thank you, Mr. Chairman. Thank you for the opportunity. Again, my name is Jerry Harris. I am co-chair of the City of Charleston Human Affairs and Racial Conciliation Commission. We were established in 2022 and charged with responsibility for addressing and making recommendations to council and the mayor in the areas that might impact racial equity. HARC's mission, outreach and education mission is not dissimilar to the Health and Wellness Advisory Committee's responsibilities. And quite frankly, we have not been as aggressive as necessary or appropriate in communicating with you. And I thought I asked Chairman Shealy to allow to re-disseminate the recommendations from the Special Commission of Equity, Inclusion, and Racial Reconciliation, which was done in 2021, and to share and ask the advisory committee members to reflect on what updates there might be in terms of actions that are taken so that we, as we report back to City Council and parallel our work with the work that you're doing, can be more effective. The Special Commission report, which was handed off to us as a source document, came out of, was based in the 2015 countywide disparities analysis done by the Avery Research Center. That data obviously is dated. In the final report of the Special Commission, and they identified social determinants of health as kind of the center of their work. You obviously are very familiar with the social determinants as we've listened to your work, and we're really curious to know of the strategies, what kinds of updates. For example, the report speaks specifically to the 2019-2023 Tri-County Health Improvement Plan. And obviously, as we're past 2023, is that plan being updated? It speaks to encouraging collaborations, which this group obviously is, and it speaks to addressing increasing opportunities for access to healthcare for low-income communities. Currently, HARC is talking about and monitoring and interacting with city departments and agencies. I see Adrian Swinton on the phone. Adrian is the manager of the office. I should have said from the start, the commissioners are each appointed either by the mayor or by members of city council, and it's our responsibility to reach out to other entities and groups who are working in the area. And obviously, this is a one-stop shop in the area of health disparities and environmental justice. So, in essence, what we wanted to do was bring to your attention the recommendations, see if there are opportunities to further educate the public or to update recommendations to the mayor and city council in ways in which we might be able to collaborate with you. I'm not going to insult you because all of you can read, and Paul was kind enough to disseminate the recommendations. So I point to the current discussions of the water plan implementation, the regional unhoused initiative that's been introduced by Mayor Cogswell, the city's peninsula plan, the Charleston Housing Authority's implementation of the RAD program, and the city police department's movement toward a 2025-2029 strategic leadership plan in the area of public safety. All those are things that we're monitoring, and we'd be curious as to the degree, are there other things that are on your wavelength that we should be talking about, getting smarter about. Finally, we will certainly encourage our members to, and Bonnie Cleveland, Dr. Bonnie Cleveland, who is leading our charge in the area of health and environmental justice, will be, as will I, continue to monitor the meetings of this advisory committee. And I look forward to working and supporting any work that we can do together to improve health conditions and address health equity in our community. And thank you for this time. I appreciate the opportunity to speak with you.
Great. Thank you for taking the time and joining us this morning. So any questions or comments for Mr. Jerome Harris? Anyone?
Kevin, if I could maybe just interject some of the items, and I'm gonna pull up the screen real quick.
Yeah.
To just talk a little bit about, we've during this period of time, as we've looked at this document that came out in 2022, I believe, one of the first items that was brought out was the health was one of the items that was come out is how do we look at making sure that policies throughout the city are put into place. And when they Kevin, when the or committee, when we did this together, is when the city plan was being put together, we did meet with them, a little subgroup of ours met with the departments and talked about putting health and equity in all policies approach for city government. And with that, there was a lot of different elements put into the city plan that really started mentioning the word the health and equity and looking at making it part of policy as we go forth with this land planning document. So I think we at least started the discussion and have it in writing. And I know that it's a guiding principle now with the city plan. So that's one positive thing that initially first came out of all of this. The second one, that of encouraging healthy eating, physical activity, we've really very fortunate. We've got some really great champions on this wellness advisory committee, and that's one in Nick Osborne and Maggie Dangerfield with the school district, and Dr. Richardson with the health department. But we really have been really talking, trying to educate our community through putting it into our neighborhoods and putting it in other publications out there about what's going on with and where they can find food in their communities and pantries and access. And Nick Osborne's going to report back in November what the food bank's doing. But if you go to his website and you click on find food, and Nick can jump on this one, it'll take you right to what's in your community and how to get access to it and what's open Monday through Sunday. And so there's a lot of opportunity there that we just need to just keep doing what we're doing, is trying to tell people and getting the information out there to help pass it on. We talked a little bit about obesity in the school districts, and and have brought on some experts, and Kimbo Yee at the Citadel has been, that's his, and Morgan Huey at the College of Charleston are strong leaders in these fields and are working on different solutions as well as what's going in the park plan. So I think, and if you look at our meetings for the last couple of years, we've taken the items that were identified in the community health needs assessment, which Jerome, recently the 2022 report came out from them, that Quentin Tompkins was a member of that advisory group, and they have put together the statements of what are the 5 top areas. They really didn't change from 16 or 19. The order maybe changed a tiny bit, but those items are the ones that we've been really trying to bring to discussions here and trying to get out into our community ways that we can make differences with it. We brought CARTA to the table to one of our discussions to help tell about how all of their programs are available to try to, if somebody's stuck at home, at how they get to doctor's visits and all. So again, a lot of our meetings have been focused on those health needs assessments that have been brought up to us, as well as trying to address items that have been listed in this this document here. I do know there's a lot of work yet to be done on looking for looking into more places that are available open after hours and on. We supplied the information that Try to United Way has pulled together for all the different providers in our area. The question is, it's still what pocket areas are we still missing? And I know we don't have a health department in downtown Charleston, but we have one readily accessible right there on the bus line in North Charleston. So right at the rivers and at McMillan, so right across from the old Navy Hospital. But again, it's all about how do we keep messaging and getting it out there and getting neighborhoods talking and staff talking and saying the right language. We had Adrian on to speak to us back January, I think in 2023. And one of the things that I was very impressed with what she had said in all those conversations is they've been spending time with city staff trying to teach and help us all learn. I mean, it's not a one-way spot, but learn how to be better listeners, that we understand really what's being asked of us and trying to find solutions. So I just say all of that. I think we've been doing a lot of work on this. I just think it's more through the community members that are not only sitting on this advisory board, but also the ones that we're sharing information with to help get out to our different neighborhoods and to our general public and trying to get it. So I just wanted to give that little brief update because I think the committee's been working good on trying to bring those topics to the table.
Thank you, Paul. Anyone else?
Thank you for that update.
Yeah.
And it is extremely positive. One of the important things is the intersection of the social determinants of health touch in so many areas. And so the work that the information as broadly as possible is important. Thank you for this opportunity again and for the update.
Yeah, thank you, Mr. Harris. Appreciate all your work too. Thank you for everything you're doing. Paul?
Evan, I really want to give Nick the opportunity because he was so sad to say something last meeting and it got canceled. Nick, do you just want to say anything about your website and how to remind everybody how they can find information?
Yeah, sure. No, thanks, Paul. I mean, you covered it very well. And I think your explanation demonstrates how easy it is to use it as well. Going onto our website, as you say, clicking on Find Food, and there's a whole host of information there, both in terms of pantries that are available. So it's easy, click on Find Food, you put in an address, put in a zip code, and that takes you to all of the sources of access to food in the vicinity of where you've put in either an address or a zip code. We've actually spent quite a bit of time over the last months updating that to actually provide more detailed information of what the different pantries that provide food are able to offer in terms of services, and we continue to build that out as well. So we're using a new platform to be able to share that information as well. So that is continuing to grow with more information. Also, there's additional information there in terms of some of the food distributions that are being done as well on a monthly basis. So calendar of events where our neighbors are able to access, whether that be in West Ashley or wherever in the vicinity of where they live. So a lot of information there. We continue to update and make it as easily as available as possible. Also, just another important point, I think, on our website as well, that the website, we have the ability through a little figure in the bottom, I think it's on the bottom left-hand corner, to translate that website into any language. So again, bearing in mind that a lot of our neighbors, English is not the first language. There is also the ability to access information in, I think it's over 90 different languages now as well. So very easily accessible with a lot of good information as to where to access food.
All right, very good. Thank you for that update, Nick. And while we're kind of on that subject, I don't want to put him on the spot, but I think Jonathan Kessler has something for veterans, an app or some other information possibly. So just wanted to ask you.
Sure, absolutely. Good morning, everybody. I'm Jonathan Kessler with Suicide Prevention here at the VA. I was just reading the chat and I noticed Jennifer Brush's camera and microphone isn't working. So it is Suicide Prevention Month. Just wanted to share that real quick. It's National Suicide Prevention Week, September 8th through the 14th, and then World Suicide Prevention Day is September 10th. I had been notified that in early August that a new department of VA had opened up, and this was to prevent our veterans and families from getting scammed. essentially when filing claims for pension and compensation. So I'm just going to read this real quick. Public service announcement. The U.S. Department of Veteran Affairs and the Biden-Harris administration announced the launch of vsafe.gov and the telephone number. I'm going to drop this in the chat. A new government-wide website and call center designed to protect veterans, service members, and their families from fraud and scams. So in case you have, so that you'll have a system for sending resources and services to community coalition members and throughout. Please do share this. So the PACT Act, we have been able to enroll many more veterans than before. And in doing so, it's also unfortunately brought out a lot of bad actors that have also come out of the woodworks as well and taking advantage. So you'll see a lot of different, thank you, Paul, for pulling that up. You'll see a lot of different categories in which this department is looking at specifically. So if a veteran family member has questions, if you have questions, this is a great place to dive into. So again, just one more service so we can protect our veterans and families that served us that may be taken advantage of. So thank you so much for allowing me to share that.
Thank you very much. Any questions from anyone there? Okay. I'll kind of just open it up now for, for community information. Nick, you have something?
Yeah, thanks, Kevin. Sorry, I didn't even have a chance to put my hand up and you asked. Paul, thank you so much for sharing out the flyer that I shared with you to everyone. To September is Hunger Action Month, and we celebrate it in a number of ways. I think it goes in quite well to what you were talking about before, Paul, in terms of the need to encourage healthy eating and drawing attention and awareness to the issues associated with hunger and food insecurity. So we have our fourth time we've held this annual event, which is our Walk to Fight Hunger, which is on the 22nd of September. That's a Sunday between 11 and 2 o'clock at Wanamaker Park. It's a great event. It's grown over the last 4 years. And as I said, it's an opportunity to draw awareness to issues of hunger and food insecurity, the importance of nutritious food. It's a fun day for family, kids. There's a couple of different walks to do. Last year, we had over 400 people, different tables that were chaired by different organizations. So a great opportunity to come out and support the work that's needed in our community to create the awareness and access to food for those that don't have access on a day-to-day basis. So please share it. We obviously want to get as many people out as possible to draw awareness and to continue that fight against hunger.
Great. Thank you, Nick. Anyone else have anything for the community? All right. Well, if not, as of right now, our next meeting will be in September. I'm sorry, it'll be October. But we may be sending out a little survey for you to take to see if there's a more convenient time to meet. There's been some conflicts, and we may just send out a little thing to click and say this might be the best time, so that we can make sure it's a convenient time for everybody. Obviously, we've got a lot of busy people on here. Just want to make sure it's as convenient as possible. Paul?
Kevin, would you share what Jennifer put in the box?
Yeah, let's see. Okay, so Jennifer Brush says, we've served almost 7,000 callers at our Charleston 988 line service since opening in June of 2023. Our 24/7, 365 mobile crisis statewide call center has served over 106,000 callers since opening in 2020. 843-414-2350 or toll free 833-364-2274. The Charleston Dorchester Mobile Crisis Team responds to over 100 calls monthly. So.
I wanted to say that because I want to say that to Jerome as well too. One of the issues was talking about mental health, and the fact that we've got the Department of Mental Health on this committee we've been talking about South Carolina Hopes, and we've been talking about all those resources and finding ways to get them out in our community through the utilization of partnerships with the Department of Mental Health. And so, that's why I'm so proud of the special group that's on this committee. It's well represented in our area, and trying to get that word out as much as possible for the determinants of health issues that we, specifically mental health, that we've been really concerned about. So
very good. All right. Anything else for the good of this committee? Anything we need to let the public know? Well, if not, great meeting, a lot of good information, and I appreciate everybody's time. I know how valuable your time is, and how great you are out in our community, and appreciate all the work you do, and appreciate the time that you give to the city of Charleston, and helping us be a healthy or more well city. So we appreciate everything. If we don't have anything else, we stand adjourned.